Right, so I'm seeing on the chat now, Doc, you can't see the chat, but my sister says, hi, Dr. Hadeed. She's out in Toronto right now. Shaman Sedano says he's extremely experienced. I think there was a Noel who I knew him when he was at Carib, who spoke to the fact that, getting treatment for one of his relatives was so important. And I have a few more surprises lined up for the show. So I know people want to hear music. So just tell us quickly the benefits and advantages of a PET CT scan. Because I've been playing the videos and people have been seeing this stuff. But just give it to us quickly.
The cancer grabs on to this special radioactive isotope that is made. And when you do the scan, the cancer having grabbed very vividly to it, it's easily detected and detected in a very sensitive way so that you can actually detect small changes as you would need to know from when you're being treated. So not only is it important to diagnose cancer, especially in the early stages when you're not sure, but also when you're being treated, it's important to know that you're getting the best treatment, that the treatment is actually working as it should, and you're not going to pay for this 6 months down the road when you see that the treatment hasn't done much for you. So these are the benefits. The challenges is that doctors are a bit creatures of habit, and so many of them are comfortable in their old ways, and not all of them are tuned to this, and not all of them realize the benefits and the advantages of what it offers. So the hurdle here now is to try and get the patients to realize this is what you need once you are thinking cancer, once you are thinking whether you have it, whether you need to diagnose it, whether you're being treated and you need to manage this properly. This is the right scan to do. And whether it is that the doctor realizes it or not, you as a patient must take responsibility for your own life. Because first world technology is something that we should always try and adopt. Specifically, this month is Breast Cancer Month, and breast cancer has now surpassed the other cancers and has now become the #1 cancer in the world. Breast cancers have overtaken actually the other cancers, especially here in Trinidad. And it accounts for something like just under 25% of mortalities, meaning that of all the cancer deaths that you would see, breast counts for just under a quarter. So that is serious numbers. And it means our women out there are being endangered. And so it's important that they look at breast cancer very seriously, especially if you have some family history of it. You should be regularly doing self-examinations. And once there is any incurrence of a small lump, that needs to be handled and treated immediately.
Wow.
Breast cancer management is actually fairly straightforward. One needs to do a biopsy of the lump so that one knows exactly histopathology so that you can know exactly what direction your treatment should take. And then more so, you absolutely need a PET scan. Don't rely on a normal CT scan because errors can be made. 35% of the time, you miss critical details when you do a normal CT. So with breast scan, you need to establish the spread. You need to know exactly how much this has metastasized. And nothing does that well like a PET CT.
Right. Wow. Well, so I just want to deal with one more item. Something that you don't know. When you first opened your lab and you all were doing testing of the machine, you know who went through your facilities? You know who taught? You know who laid down in the machine and did a basic MRI, not a PET scan? Yours truly and my wife, because Nigel had us as the guinea pigs. Yes. Thankfully, the scans came back okay. But I was in your place before you even opened. I'm sure you don't know that.
Well, and it's good to hear that your experience was good.
Yes, it was good. It was good.
Yes, very much so. We've actually had the unfortunate experience to realize breast cancer in Trinidad is actually much more prevalent than even lung cancer. But the difference is you can catch breast cancer much earlier and be able to make a difference in the outcome and a difference in the life of the patient. I'll go so far, Rene, because you've been such a passionate presenter, that I will offer the next 10 people for the month that if they call your name and they say they are a follower of this program, I will give each of them a coupon.
Wait, so the next, okay, so 10 people who call your establishment, talk to your folks there, the fantastic team, I only hear good things, you will honor that discount for 10 people.
10
folks,
people.
You hear that?
As long as they see that they love DJ Rene, use those magic words, and I will honor that coupon for 10 people.
Well, Doc, I look forward to meeting you in person. I see you on TV all the time, and there's so many different brands that we could talk about. But I think today we're going to focus on the PET CT scan and the difference it could make for somebody who has the need for early detection in cancer. And of course, for this month, we're dealing with breast cancer as well. And folks, I just want to give you one warning. The discount you see on TV is a different discount to this discount. How I talk there, Doctor? So it's a single discount, a DJ Rene discount, which is $5,000.
Yes, exactly. So I wish I could honor both discounts, but we can't. But definitely, once they say they like DJ Rene, they have our passion and following.
Well, good. So, Doc, thank you so much for coming on. You do, as I told you earlier, you don't know what this means to me, and some of the people watching on, you don't know what it means to them. And well, you could enjoy the rest of the show on Tigo. Your staff is locked on, and yeah, my sister is saying proud of you, brother. Charmaine is saying wonderful. Somebody, well done, Doc. Ladies, jump on it seriously. Wow. So there you go, Doc. We have done what we came to do.
Thank you so much. Thank you so much, Rene, and thank you to all your followers. And hopefully we would have made a difference.
That's all.